And hey guys, welcome back to the channel. So, if you're a foreign trained ophthalmologist, foreign trained optometrist, optician, or you worked in eye care or any eye care related field before you moved to Canada, you reside in Canada, or you intend to move to Canada, or Canada is on your radar, right? This video is for you. You have to stay and watch till the end because we have useful insight with respect to how to get a job in an eye care field in Canada. So yeah, my name is Ufoma Juliet Onomwe. You can call me UJ. If you're seeing me for the first time, I just introduced myself. So do well to subscribe to this channel because we have more useful insights for you with regards to the job market in eye care industry. And make sure you like or share this video with your friends, with your family members, and all. Yep. So let's rewind and come back to the topic. Yes. So if you're foreign trade optometrist, foreign trade ophthalmologist, optician, you worked in eye care before, you've been a screener in your country or wherever you are, right? And you're moving to Canada or you just moved. These are jobs that you can actually do to put your foot in the door in the eye care industry that will help you stay connected to the field that you love and also help you gain Canadian experience in terms of what's obtainable in the eye care industry. I have a list of those jobs and I would like for you to watch till the end because the last one would shock you. Okay, let's go to the first one. The first job that you can do if this is your field first is medical scribe. So as a medical scribe, what you do is to document patients encounter with the doctor during the eye exam. So basically you are going to be in the examination room with the doctor. So while the doctor sees the patient, to ask the patient questions and all of that, you're going to be there and you're going to take notes. Or the patient said, "Oh, my eyes are hurting," or "My eyes hurt when I wake up from sleep." You're going to type that down. Okay, this helps to improve the clinic efficiency and give you valuable exposure to how cases are being seen and managed in Canada, right? So as a medical scribe, it exposes you to a lot of pathologies, a lot of diseases that happens, and how the doctors interact basically with the patient. So this is going to be good for you if you already have previous experience in eye care. So you're not going to find it difficult to put down your findings. So the medical scribe is a very good place to start if you have these previous eye care experiences. Okay. The second job that you can do as a foreign trade optometrist, ophtho, and optician is the optical assistant or optical dispenser. So in Canada we have some optical shops where they sell products, where they sell glasses, lenses, frames, and all of that. So you can get a job there and work as an optical assistant. Basically, if you enjoy retail, if you enjoy talking about fashion in eye care, if you enjoy working in optical shops, this is a good place for you to start. You help patients to choose frame, you help patients adjust frames, you educate patient, right? You explain to the patient how lenses work, how the frames work, and all of that. You make minor adjustments if you work in an optical shop, minor adjustments to frame. Yeah, you're gonna have good encounter with a lot of patients in terms of frames fitting, lens fittings, and all of that. If you work as an optical assistant, an optical dispenser, right? Some optical dispensers also do pre-testings and screenings like VA check, eye pressure check, and all of those tests. So this is a job that can expose you in that regard. And the third job that you can do with your previous eye care experience is the optical sales representative. It's a little similar to what we just talked about, which is optical assistant and optical dispenser. But for this one, what you're going to be doing is to work with the companies who produce these frames, produce these lenses. So basically, it's your job to introduce this new new frame, to introduce this new design to labs, optical labs, to optical centers, to clinics, to opticians. Basically, the companies will hire you as a representative. So you take this product and you go to the the clinics basically, and you introduce it to them, tell them the importance, tell them the usage, how good they are, and then hopefully you get someone who's going to purchase. Yeah, that way you will be enjoying working with people, meeting new people, meeting opticians, meeting optometrists, ophthalmologists while you do your job, and then that will be good exposure for you if you want to delve into the eye care field. Okay, so now let's talk about the next role. The next role will be dry eye consultant or an ophthalmic hygienist or an optometric hygienist. So dry eye is really prevalent in Canada. A lot of persons have dry eyes, like their eyes are really dry and it's burning and all of that. So with your current exposure to eye care, you can be a dry eye consultant, you can be a dry eye or an ocular hygienist. Basically, what you do is educate the patients about dry eye, recommend dry eye treatments. Not all of them, they're the dry eye treatment that only the licensed optometrist can dispense. So basically, you recommend the ones that they can buy outside. You do cleaning, eyelid scrub for the patient if they have like cross on their lid. You do testing, you check their meibomian gland, you make sure they're producing enough tears. You do your Shima's tests. So all of those things that are pertaining to how much tears you produce, or how your meibomian glands are, or how your body, your eyes are secreting tears. So those are like the job of, not, I didn't mention everything, but it's part of the job of an ocular hygienist or a dry eye consultant. Okay, and then whenever there is a new innovation in dry eye management, you get to know first, and then you get to educate your patient first. Also, you could also recommend like the warm pads to the patients to put over their eyes for some time. So there are a couple of things you can do as an ophthalmic hygienist, and that's a good role for you to start with if you're looking to get into the eye care industry as an ophthalmic hygienist. Okay, I've used ophthalmic hygienist, ocular hygienist, optometric hygienist. They go hand in hand. You can use one before the other. Okay, you can use one for the other. You don't have to use everything together, right? Yes. So that's the fourth one. The fifth role you can delve in, the fifth job would be an optometric assistant. So we have a lot of optometric clinics in Canada. Um, I'm sure you have one in your city where you live, or if you don't live in Canada yet, there are lots of optometric clinics here that you could go to. So basically, what you do for the optometry clinic is to do vision check, do pressure check, do your basic preliminary testing, you do your pupil assessment, basically work up the patient for the optometrist. You do case history, which is very important. Do case history, and then you document all of your findings. So an optometric assistant also could help with IPD measurements, base curve measurements for contact lenses. You are doing cover and uncover tests. You are doing color vision testing. I'm just trying to remember all of them off of the top of my head. But you are doing all of this workup, and then you document for the optometrist, such that when the patient gets into the doctor's room, basically what they would do is the optometrist just talks over the test results which you have done with the patient. Some optometric assistants would also do some front desk role. Basically, you can troubleshoot patient's insurance and yada 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 yada. Yada. So an optometric assistant basically works in the optometric clinic with the optometrist. Okay. So now the next will be technician roles. Okay. There are different types of technician of ophthalmic optometric optical technicians, right? So if you're one person who is very good with instrumentation, you're good with instruments, or instruments don't come difficult for you, basically you can do this. You can do this role. So you can troubleshoot instruments, like when instruments are faulty, you troubleshoot them. You make minor repairs, okay? You also do picture taking, like you're doing OCT, you're doing visual field, you're doing contact lens fitting. Some technicians do contact lens fittings with the supervision of the optometrist, of course. You're doing cornea topography and all of those testing. So the last role, which we've all been waiting for, is the ophthalmic technician. Not just the basic technician we just talked about. The ophthalmic technician, basically you work with ophthalmologists. Okay, you work with ophthalmologists, just like the optometric assistant or technician. You do vision pressure testing, you do your case history. You basically work with the ophthalmologist, right? You assist them when they're doing certain procedures. You do your color vision, you do your dry eye assessment. You just basically work with the ophthalmologist, okay? Um, there are a couple of certifications that you could take, but it's not a prerequisite to work as an ophthalmic technician in an ophthalmology practice. I'm going to list all of that out in another video, which should come next week. I hope you stay tuned to watch. So to wrap it all, I'll just go over everything so that you don't forget. First is going to be the medical scribe. I talked about what the scribe does. The second is going to be the optical assistant and optical dispenser. We also have the optical sales representative. Then we have the ocular hygienist and dry eye consultant. Then we have the basic technician who troubleshoots instruments and also does testings, OCTs, eye traces, and all of those testings. And then last and not the list, we have the ophthalmic technicians. Remember, the ophthalmic technicians work with the ophthalmologists here. If you are in the eye care industry, these roles are could be starting points for you, especially if you're looking towards practicing optometry, ophthalmology, or opticianry here in Canada. These roles will actually expose you to the eye care industry, and then from there you can network as much as you want, and then from there you know what's happening in eye care, and then it will be a good platform. You also get to network and communicate with your doctors and people in the eye care field. So remember to like and subscribe to this channel, like this video, and share with your friends. So if you have friends who are in Canada, if you have people like that and they are in the eye care industry, do well to share this video with them. If you currently work in eye care, please leave your suggestions in the comment section, and I will respond to them. And if you have insights you want to share with people with respect to how to get into this field, do it to let me know. Okay, now I'm gonna let you guys go. Ciao.